Is ingesting collagen truly effective for skin? The inconvenient truth revealed by the latest meta-analysis. Do you take collagen supplements every day? You've probably been tempted by claims like firmer skin, reduced wrinkles, and improved hydration. TV commercials and social media are constantly flooded with advertisements for collagen products, edible collagen, drinkable collagen, and even those processed into coffee or jelly, all targeting consumers' wallets. However, a recently published study casts significant doubt on this belief. Is collagen, which we've relied on for our skin, truly effective? Collagen is a core component of the connective tissue that supports our body, forming the structure of our skin, joints, muscles, blood vessels, and bones. But as we age, collagen synthesis decreases by 1.5% annually. Reduced skin moisture, decreased elasticity, and wrinkle formation are natural signs of aging. To fill this gap, ingestible collagen became a boom in the early 2010s. Various products, powders, capsules, drinks, and jellies appeared, and SNS influencers marketed them with slogans like, "Just 2 packs a day leads to firm skin," or "Consistent drinking for a month guarantees a change." Consumers were swayed by the argument that topical cosmetics have limits, ingesting is more fundamental, and collagen quickly became the dominant force in the beauty and health food market. However, the new meta-analysis released by Professor Myung-Sung Kwon's research team at the National Cancer Center showed results that challenged this existing belief. Results split dramatically based on funding source. The team analyzed 23 randomized controlled trials, RCTs, published in international journals from 2014 to 2024. RCTs are considered the most reliable method in medical research, and by applying a meta-analysis, which synthesizes multiple studies into a numerical conclusion, this report effectively summarizes all current collagen research. On the surface, there were positive findings. Consuming collagen in pill or drink form was observed to increase skin hydration, improve elasticity, and reduce wrinkles. One might be relieved and think, so collagen works after all. However, the team did not stop there and reanalyzed detailed factors, the source of funding and the quality level of the research. The surprising fact was that the results differed significantly based on the funding source. Studies sponsored by pharmaceutical companies or collagen-related businesses mostly reported an effect. In contrast, independent studies that did not receive corporate funding observed no effect. In other words, positive results were more likely to come from research with vested interests. Effects only observed in low-quality studies. The results regarding research quality were similar. Low-quality studies with small sample sizes and poor experimental design reported effects like improved skin elasticity or reduced wrinkles. However, high-quality studies with larger sample sizes and strict criteria found no meaningful difference in skin hydration, elasticity, or wrinkle reduction. This makes us reconsider how reliable the phrase "effect proven by clinical trials" truly is in advertisements. A critical scientific question arises. Can ingested collagen really directly affect the skin? Collagen is a large protein molecule. During digestion in the stomach and intestines, it is ultimately broken down into smaller amino acids. The mechanism by which these absorbed amino acids are resynthesized into collagen and reach the skin's dermis has not been clearly proven. While marketing phrases about low molecular weight collagen for better absorption are rampant, scientific evidence remains scarce. Most studies included in this meta-analysis were conducted in East Asia, Korea, Japan, China. The number of participants ranged from a minimum of 16 to a maximum of 120. Totaling only 1,474. This is insufficient compared to the large-scale clinical trials in modern medicine that involve thousands of people. Smaller samples are more susceptible to random chance or specific group characteristics influencing the results. Therefore, the research team's final assessment was that it is difficult to conclude that collagen prevents or improves skin aging based on current evidence. Scientific evidence versus flashy advertising. Professor Myung-Sung Kwon stated, "Collagen is an important cellular component, but the clinical evidence that oral supplements directly affect the skin is still insufficient." Specifically, studies supported by pharmaceutical companies tended to show an effect, while high-quality studies did not. Moving forward, we need independent research without vested interests, large-scale clinical trials involving thousands of people, and a clear elucidation of the biological mechanism by which collagen actually affects the skin. The choice now rests with the consumer. We are constantly exposed to ads claiming collagen improves skin, and we hear testimonials from others who feel they've seen results. However, science draws conclusions by synthesizing vast amounts of data, not just personal experience. This study highlights the inconvenient truth, the gap between the hope that collagen might work and the reality that evidence is lacking. In conclusion, the most certain way to maintain skin health remains the basics: a balanced diet, sufficient hydration, sun protection, regular exercise, and sleep. These lifestyle habits are the scientifically proven anti-aging measures for the skin. If you've been relying on collagen, it's time to take a hard look. We should trust the scientific evidence provided by data, not flashy advertisements.